Hello, everyone. My name is Kendra Mickens, and I'm going to be presenting Chapter 53 to you, Drugs Affecting the Uterine Motility. So let's bring it up. We have a couple learning objectives. We're going to look at, of course, since we're dealing with pharmacology, identifying core drug knowledge, also looking at core patient values. We also are going to look at the relationship between the interaction of core drug knowledge and those core patient variables, Then we should be able to generate a nursing plan of care for these medications. We should be able to describe nursing interventions, as well as determine key points for patient and family education for drugs that affect uterine motility. As we look at these medications, we're going to actually be looking at medications that fall into pretty much two different classifications. We're either going to be looking at a medication that can either start or stop labor. So when we look at it, we actually have to go back a little bit and talk about the process of pregnancy and the process of labor and then eventually delivery. So when we look at it, pregnancy usually follows a set timeline of events, and you can see contractions usually start at between 38 to 42 weeks. But when that does not occur, at times we may actually have to use medication to assist in getting a labor started. So when this doesn't happen, labor often has to be something called induced. And we see induced is when labor is initiated by use of medications. There are times as well where women will spontaneously go into labor, but for some reason that labor will then slow down. And you can see the next term on here is augment. So you can see when natural labor starts but then slows down, we may have to then augment their labor. One of the other topics that will be covered in this chapter is pretty much just the complete opposite. Sometimes instead of women not going into labor on time, they actually go into labor a little too late. And